primary contracts, when you talk of medical insurance, contract number 1 is between the patient and the insurance, the payer and the patient. Contract number 2 is between the payer and the provider. Contract number 3 is between the provider and the patient. There are 3 types of contract. The first contract is between the Kenyan people and the Social Health Authority. If that contract fails, all the other contracts fail. So what we are saying right now is that Kenyan people need to ask themselves, as I am contributing to SHA, am I getting worth for my money? And if the answer is that your money, you are not sure if it is safe, and you are not getting worth when you go to hospital, you are being asked to co-charge, the first people to ask, we're asking the Kenyan people, ask Social Health Authority, where is our money going, and why are we not getting worth for our money? Hospitals have another contract with SHA. We will follow our own contract, but the first contract is between the patient and SHA. And we are asking patients, if you go to a hospital tomorrow and that hospital tells you your SHA cover doesn't work and yet you have paid, walk to your nearest SHA office and ask them why. Famous 104 billion shillings. To be honest, it's one of the worst things that has ever happened, because now we are almost in September. It's 1 year since that consortium came into this country. When they say they will bring AI, they will bring digitization. In fact, the excuse of firing 1,000 people from NHIF was that we need all these people, AI will work, all these people. So what did they do? They fired quality assurance officers, they fired surveillance officers who are moving around village to village confirming that patients are admitted, okay? Instead of retraining them, retooling them, increasing their capacity, they made 1,000 Kenyans jobless to replace with a system that to this day, nobody has ever seen any evidence of it. The whole system is run by companies which are not local, international people. We don't know, whether our data is even secure, those people who are handling this data. So the point is this, 1 year trial for delivery of system is enough. If they are unable to deliver a fraud detection system that ensures that genuine hospitals and genuine doctors are paid and patients don't go to hospital waiting for 3 hours for OTP, if they are unable to deliver that, we respectfully ask the president, please send these people back to Dubai, where they came from, allow Kenyans to handle their issues. There has been a deliberate attempt, the deliberate crusade by this government to say everything about NHIF was bad. Everything about NHIF was in Kenya since 1966. Surely, you're telling us for 50 years we were just living in bad situation. This is not true. The deliberate, they say this, when a hyena wants to eat her children, she starts saying they are smelling like goats. This is the reality. They want to eat the little that was coming there. Now they are starting to say NHIF was corrupt. If NHIF was bad, why did they retain 800 staff of NHIF? If NHIF was bad, why did they transfer the accounts, the bank accounts, directly from NHIF to SHA? Why did they transfer 4.2 million Kenyans directly from NHIF to SHA? We should stop talking about that. The reality of the matter is the simplest way. Number 1, stop asking Kenyans to pay annually. Allow Kenyans to pay the way they used to pay to NHIF. That was a good thing. You can't call everything bad. Okay? Stop that. Number 2, the issue of proxy means testing. Going to ask people how much do you spend on food, whether your house has tiles, must stop this. Let them flat rate, even if it's 500, 600. The president promised 300 for those who are poor. Let them flat rate this thing, allow Kenyans some time, even if it is 2 years or 3 years of contribution. Number 3, pay genuine hospitals. The whole issue of paying into dummy bank accounts so that the money can be diverted, we have seen. And then when the genuine hospitals make noise, you call them fraudulent. The way the hyena calls his children smelling like goats in order to eat them. Those ones must stop. That is the only way to save this situation.